Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade, and I'm a naturopathic doctor. And I am pleased to be joined today by Dr. Jaquel Patterson. Dr. Patterson is a fellow naturopathic doctor. She practices in Fairfield, Connecticut. And her practice, as best I can tell from what I've gleaned from following her on social media and checking out her website and whatnot, is her practice focuses heavily on different complex chronic illnesses. So perfect guest for the podcast. She's a member of the International Lyme and Associated Diseases Society, also known as ILADS, kind of the preeminent association or group that offers certification training for folks looking to treat individuals with chronic Lyme disease, persistent borreliosis, co-infections. They've also kind of branched out to cover other areas too, at some of their conferences like mold illness and mast cell activation disorder and things like that as well. She's also a member of the Medical Academy of Pediatric Special Conditions, also known as MAPS. So she has a focus on autism and PANS and PANDAS in her practice, treats autoimmune disorders, etc. So really excited to pick her brain. I've never met Dr. Patterson before, and just again from just seeing what she posts on social media, I think she has a lot to share. So I'm really hoping that listeners will gain a lot from our conversation. So I'll bring her into the conversation in just a couple of minutes, just while waiting for her to log on. I'll just quickly invite anyone who hasn't yet signed up for my newsletter / mailing list. If you're interested in doing so, the link for that is in the show notes for this episode, or if you're watching this on YouTube, it's in the description of the video below. If you sign up for my mailing list, you do get complimentary access to the first 2 modules of my Overcoming Chronic Illness course. It's a comprehensive course that I've put together covering topics like I just alluded to there, such as chronic infections, mold illness, heavy metals, mast cell activation disorders, chronic digestive issues, etc. It's essentially, for all intents and purposes, kind of like a roadmap or a kind of a navigation course to sort of navigate the waters of complex chronic illness, which is very complex. It really lives up to its name. And so it's a course that I designed for folks who are dealing with complex chronic illness themselves, or maybe have family members who are dealing with complex chronic illness, friends, whatever it happens to be. And there are just a in-depth review of all of the major topics that I've discussed with my patients all the time when they're coming to my office dealing with complex chronic illness. So if you're interested in that course, please consider signing up for the mailing list to get complimentary access to the first 2 modules. And then also you'll be on my mailing list and just hear about upcoming podcast episodes and just things that I'm doing in my practice, things I'm excited about, etc. So I will pause the recording here, and I'll be back in just one moment with Dr. Patterson. All right, everyone, I'm back with Dr. Patterson. So Dr. Patterson, thanks so much for joining me today. I'm really looking forward to our chat. And would you mind just giving the audience a bit of a background on who you are and how you got involved working with folks dealing with chronic illnesses?
Yes, I'm really excited today to be here and to talk about some of the work I do. My name is Dr. Jaquel Patterson. I'm a nationally recognized naturopathic physician. I'm also a Forbes contributor, Amazon bestseller, also ×3. And I also was the past president of our American Association for Naturopathic Physicians. So been practicing for about 15 years. And I'm practicing out of Connecticut with Fairfield Family Health, but I do see patients throughout the country. About 40% of my practice is actually telemedicine. So that's the interesting thing with chronic and complex diseases, that oftentimes many of the patients I know you see as well as I see have been to 7 to 9 doctors before they come to see us, and they're coming really seeking answers because they're having a lot of illness, basically symptoms that aren't really being either recognized as an illness or not fully worked up, or just unsure about what's going on with them, but they know they just don't feel like themselves are not well. And so I actually got into it at when I was in actually naturopathic school. I had a lot of symptoms of chronic fatigue. I'd fall asleep everywhere. I had physical pain, joint pain, body pain, headaches, insomnia, and also was having a lot of anxiety, to the point where I was like, well, it wasn't just anxiety. It didn't feel like anxiety. And this is when I went to go and find out that I had actually Lyme disease and Babesia and also Bartonella. So I had several different tick-borne infections. But they had thought at the time it was just anxiety because I was younger. I was 28. And I would just be grocery shopping and I'd be drenched. Or it would be in the evening and I'd have hot flashes. And I'm like, I don't think this is anxiety because I'm getting it at times that don't make sense. Also, I have a family history of autoimmune conditions. My mother has lupus, my aunt had lupus, as well as rheumatoid arthritis. And so immediately one of the things I got worked up for obviously was for an autoimmune condition. And so there were some things that didn't really match up in the blood work. And I kind of left with, hey, this isn't an autoimmune condition. You might just be stressed and get your rest and take care of yourself. And then it didn't happen until what happened actually was I started doing a lot more self-care practices. I started doing a lot more wellness. I did a lot on herbs and nutritional changes, food, dietary changes. And when I started seeing patients myself and they started talking about their symptoms, I'm like, wait a second, these sound like a lot of the symptoms I had. And so that's actually what took me to the process of testing, because I wasn't diagnosed. And that's when all of those actually tests showed positive for many of the different disease conditions that were coming into my office and seeing as patients. And so that kind of started my story. I had other, family members that had also had Lyme disease, also autoimmune conditions. And so that always just gravitated to me naturally, really, since I was a student doing my precepting hours as well. So, and just doing our clinical hours in a rotation. So, it's more and more people are more aware of the complexities of these diseases and are seeking care for it, because they're not necessarily getting the answers. But what I like is that I have seen in the last 5 to 7 years a progression for a greater understanding of some of these unique illnesses, or were considered more unique before, that are actually much more common than we think.
And is that greater understanding in kind of the patient base at large, or in the healthcare community, or both?
I think it's both. I think there's now many different associations, different groups for people to connect in with, to be able to increase, hone their skills and their understanding. I think at least I know with a lot of my peers, I'm a naturopathic doctor, but I have a lot of friends on the other side, MDs, DOs, they're more aware of it. And now what they're starting to do is just refer, okay, I know this doesn't fit into these boxes, this box of things that I'm typically used to. So now I'm going to refer out to somebody that has a greater expertise. Also, social media has been a great thing, for a lot of patients, for looking and searching for answers, and then connecting in with different, private and small groups that are able to connect them with a provider that focuses on what their health ailments feel like, to get kind of worked up fully. So I think it's a mix of both consumer demand, seeking, and access to information, much greater access than we had even 5 years ago. And also doctors with the growth of advent of a lot of these different groups and associations of having places to send people into and refer out to as well.
Yep. Yeah, it's great that there are more options for us as clinicians. Like, it used to be kind of just ILADs, and that was about it. And now there's, so many
Exactly.
different groups now, which is
Mhm.
great and encouraging. Just kind of a bit of a random question about social media side of things, because sometimes patients come in and it's like, oh yeah, I was on this group for mast cell activation disorder, or this group for Lyme or mold, and I find sometimes it's a real asset. They're learning about different therapies. They know kind of the questions to ask. Maybe that's what's inspired them to actually book in to get worked up. And then sometimes it seems like it can be a bit of a doom and gloom, oh my gosh, you're never going to get better, you can't get well unless you use X, Y, or Z therapy. Or sometimes it's just glorifying, unless you do bee sting, apitherapy, you're never going to get better. So would
Mhm.
you have any advice to folks, or just maybe thoughts around, if you are part of an online community, are there maybe things to kind of focus more on, or kind of avoid pitfalls? Any feedback that you have about that from what you've seen with your patients?
That's a really good question, because that happens a lot. And oftentimes people come into me because of the fact that they're like, wait, I have these 10 different things and this might be Lyme disease. And they very well are often sometimes right. But then the other challenges on the other side is not every symptom is necessarily that disease condition. So sometimes what can happen is everything can feel like it's connected to that disease condition. Sometimes I tell people you might have 3 things going on. We might have MCAS, you might have, let's say, mold sensitivity. You might also have Lyme disease or Bartonella. You can have 3 or 4 things, but my goal, and anybody working with a naturopathic doctor, is to find out where did this all stem from? Because I've had patients that have had all 3 things, and mold may have been really the initial trigger of it, because mold, for example, it creates more immune dysregulation, can downregulate your system. And that might mean that something that was kind of hanging out earlier, that may have been less significant becomes more obvious because of the fact that your immune system is more depleted. Or, you might have somebody that has, let's say, Lyme disease, and that's more of the factor than those other pieces. So what I really try to do when I work with the patient is I say, like, where we want to go back in time and find out, like, what is the biggest factor leading into the symptoms that they're currently having. And I try to, it's like, peeling off an onion, try to peel off those layers, because sometimes you always say two primary things for patients that they typically want improvement is like fatigue and pain, right? And so I often say, like, okay, you might have 40 things, but what is your major issue? And typically it's one of those two things. And I say, if I don't get one or two of those things right, or you're not feeling better and you don't feel like anything got better. So let's first handle that. And then you have the energy. Like, for example, if your fatigue is better, you might start losing weight naturally. You might have energy and motivation to do the things because now you have the energy to do so. So the one thing I would say to that point is, don't completely go seeking and getting everything through Dr. Google. Once there's a lot of things that aren't adding up, this is where you really want to work with a doctor who's trained in actually doing the full workup to really direct you in pieces. Like, I always like to do kind of one thing at a time. I might do more than one, but maybe one or two, but I try not to do 5 things. I don't try to do things for metal testing and your stool and your, neurotransmitters and the Lyme disease all at once, because you can walk away feeling like completely sick, completely discouraged, like you said, completely hopeless. And my goal is really to and everybody's goal should make people feel hopeful and that there's going to be a path to getting it better. So I think this is where you really need to be mindful of being so active in groups to get answers and not actually seeking care from somebody that's an expert that's going to be able to, like, actually partner with you in that journey back into good health.
Thank you for that. And something you touched on earlier, and just a topic that's, I don't want to say controversial, but there's lots of different opinions around it, is just around testing. Like, so you said when you were back doing your clinical training and whatnot, or just around for your own health, doing different tests for, say, Lyme or Babesia or whatnot. So say, patient walks in, they've been sick for, 10 plus years. They have a history that suggests there might be some vector-borne illness going on. Could you speak to what some of your go-to testing methods would be, say, looking for, persistent borreliosis or Babesia or Bartonella or whatnot?
Yeah, sure. So there's different companies out there, different testing. I'll be mindful of not, I guess, endorsing one because I do know that there's always new ones on the market, right? There's also new groups on the market, but what kinds of testing you want to get? So when you look at,
and sorry to interrupt, you can endorse if you want to, because we're
oh,
not.
I am allowed to.
Okay. Yeah, of course. Yeah, nobody's getting CE credits for this.
So we're used to seeing me and CE as doctors when we're presenting. So
exactly.
So the companies, the biggest thing is that you want to make sure, obviously, reputable company that has experience working with Lyme disease, you want to see that they have studies of proven efficacy of their labs, et cetera, and that they're actually regulated and tested in terms of CLIA waived, et cetera. So I typically, when we're looking at it, you want to, if someone we suspect, for example, Lyme disease, like you mentioned, you want to look at, the first thing is like a Western blot. Now, some people can't afford necessarily to do through some of these specialty labs that are more Lyme literate labs. And so if you are going to do it through like a general lab, the Western blot would definitely be preferred to ELISA, because if you look at the testing, especially with Lyme disease, they're showing like 50%, 53%, 50 to 60% false negative. And Western blot also has a high false negative rating. However, it's still more accurate because you're actually getting, it's more specific and accurate than when you're going to get like the ELISA test. So that's the first thing, depending on like your access and ability to get some of these like specialized tests. The other thing I like is the immunoblot. Immunoblot is very much done in terms of the same processing as Western blot, but it's it's a little bit higher level of specificity. So if you can get the Lyme immunoblot panels, those are great. And then there's something called direct and indirect testing. So some companies have it. So one company I'll mention is IGeneX. So IGeneX is a company we use. I also love Medical Diagnostic Labs. That's one of my favorite companies to use because it's covered with insurance initially. And so that can give some preliminary information. They're more focused on tick-borne infections. So the quality of their assays are a bit better. And then also another company is Galaxy. So when you look at direct and indirect testing, you have testing that's actually, there's actually testing to see if you have antibodies to, for example, Lyme disease, versus to see if it's like active in the blood, which is direct testing. And so some of these companies have what's called PCR testing, which allows people that can get missed from the normal antibody test picked up. The reason that's important, if you suspect you have Lyme disease, is that a good percentage, about, I think it's anywhere between 10 to 20% of people do not produce enough antibodies to show positive in those tests. And this is where that PCR testing is helpful. So lots of times for me personally, I'll try to do those like Western blot, immunoblot, and then I might do more of the, if I suspect it and it's still not showing positive, that's when I'm looking at things like the PCR testing, fish testing, et cetera. Also, just to know is that with things like Lyme disease, it is technically, like per CDC, it's a clinical diagnosis. So it's not purely based on the lab test. I have some patients that are completely positive and they tested like their husband because they have it and their husband has no symptoms, and his bands may be worse than the wife, but he has no symptoms. He's asymptomatic. So again, this is why the symptoms matching with the labs, sometimes I always say the labs are really important to do. The saying test, don't guess. However, with the testing and the results comes then the clinical interpretation of how that's factoring into everything else that's going on. So I kind of mix up the companies I like the most. I would say medical diagnostic labs, IGeneX, and then also Galaxy are kind of our three primary ones. But there are many different on the market. Those are just companies that we have seen consistency in terms of like reporting and results back into our clinic.
Great. And just for Canadian listeners, where Dr. Patterson mentioned that the CDC says Lyme is a clinical diagnosis, which Health Canada says the same thing as well, just for the record.
Oh,
so North
cool.
American consensus, apparently, that it is a clinical diagnosis above all else. So just for clarification there.
Awesome.
Also, I should mention at this point, as I mentioned in every episode of this podcast, nothing that we're saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. Just on the topic of testing, and you mentioned mold as well, would you mind sharing what testing method, if anything, you employ for testing like a patient's body to see if there's evidence of mycotoxins or whatnot?
Mm-hmm. So one thing I first like to do is, if I'm, again, like initially when I see somebody, I'm trying to do as much as I could do through typically like blood, like the serology test that I can do through the general labs. And so when I'm looking at things like mold, or if I'm looking at MCAS, I might do tryptase. You could do what's called 24-hour histamine test for things like mast cell. You can also do the blood test. So you can do those through most conventional labs. So typically when I look at mold, I will do initially, unless I have a 100% strong suspicion it's connected with mold. Initially, I might just do a regular serology test that tests for Aspergillus fumigatus, Aspergillus niger, which is IgG and IgE, and then also I'll test for like Stachybotritis atra, IgG, IgE. So in those tests, when you're testing the blood, all they're showing is that you've been like chronically exposed, or if there's like kind of an allergic reaction to it. So that's helpful for me to then go based on those numbers. So for example, when you look at some of the labs here, like Quest, it's supposed to be below 2. If I have a patient that's like 100, I know there's definitely a problem, which I have with mold exposure, chronic mold exposure, and I ask those questions. And then I typically will go and do the mycotoxin test with Great Plains, or I'll do it with real-time labs. And so what you're going to look at is it's going to break it down. So if you had something like Aspergillus, it's going to break it down to like ochratoxin, gliotoxin, like the different form toxins that are going to be getting expressed from mold that's currently in your system. So when you test, the reason I want to mention that is when you test for blood, it's really just going to show chronic exposure. So you could have had high exposure like 10 years ago, and that can still show. But it does give information. If it's like crazy high, it's likely that it's probably something that's currently happening. And then the urine test, which is through a company like, like Real-Time Labs, you're going to actually see how much is currently in your system, which is really important. The other thing that I encourage people to do, which we do sometimes, if a couple of family members have it, we'll say, let's test the family. And the reason that's helpful is sometimes is to also find out, like, is this something in my house? And so that's another thing is we tend to work with companies that will help to do mold testing. Like we refer out for mold testing, or if we suspect mold remediation, especially if there's several family members where the numbers are really high, because at the end of the day, I can help to support your mold symptoms and help to alleviate them. However, if you're constantly in an environment that is exposing you, the more important thing is to actually fix the environment you're in. So it's a little bit of a mix of both of them. And we try to also like, so as soon as I find out someone's positive, we want to try to find out like where the source of it is so that we can actually prevent it. Unfortunately, for some people, it's at work. For some people, it's in the school systems, and there might not be much they can do to prevent it. But at least they will have now information to go back and maybe have some changes or remediations in some ways.
When you are working with folks who have mold illness, and whether they're currently in a moldy environment and it's pending remediation or pending moving or whatnot, or they had a past exposure and they're still lighting up like a Christmas tree with their mycotoxin testing or whatnot, is treating their sinuses with antimicrobials or other agents something that's part of your mold treatment paradigm? And if so, what kind of agents do you tend to employ?
For sure. And if there's always sometimes a cost issue when we do mold remediation. So sometimes we look at like, what are the big things, where the major areas of exposure, bathrooms, kitchen sinks, like things, basement, like where are the areas that are going to cause the biggest issues, HVAC systems, et cetera. So some people have like filters. I definitely support like filters and things like that in the house as well, just to help with cleanliness of air. And then we will look if it's positive on, sometimes we look at binders, sometimes we do look at things that help move the liver. So some things that help to move the liver, NAC, glutathione, these things help for both phase 1 and phase 2 of the liver to remove any toxins, including, plastics, pollution, any kind of environmental exposures. So usually for most people, I make sure like their liver is moving and their gut is supported before I start pulling anything out, because I guess it depends on the group, but my group tends to be like very sensitive. So if I did like binders, which I know a lot of my peers and colleagues do, and they do it successfully. For me, if I do that for my patients, like they feel horrible. So I try to like kind of prep them a little bit. And so some people are doing IVs, IV glutathione, vitamin C, and then I kind of prep them. And then the other thing is I also like glucomannan. So I do use a product called OptiFibroline, Zymogen makes, which has glucomannan, and it kind of sticks to everything in the gut too, to help getting things to move. So I'll do that as well. And then after that, I'll look at binders, like depending on the type. So if it's like, for example, aspergillus, I might do activated charcoal, or if they're high in ochratoxin, I might do activated charcoal, which has been studied for it. There's fulvic and humic acids. There's zeolite. There's the regular, like, bentonite clay. So it kind of depends on what they're coming with, but I'll typically do that for about 8 to 12 weeks. There are other treatments people do, like EDTA. Oh, that's actually more like metals and stuff like that. But we don't do that in our office. But I typically first try to get like the liver, everything moving in the system, to get their sauna is another thing I really promote, like far infrared sauna, about 20 minutes. The studies have shown to like 20 minutes to an hour, not too much, because people could also not feel so great when they're doing that. So I typically will do that to help aid exercise, movement, et cetera, to help aid in removing of it. And then what we'll do is retest, typically after about 3 months later, after being put on a protocol.
And do you at any point employ any kind of like nasal sprays, like sinus sprays or anything? Or
actually, yeah, we have done that with oregano, small amounts of like oregano, some small amounts of like berberine, other things like that. I should probably do that more, but we actually don't, because that is actually a good point, because that's where it first gets inhaled through. So that would be a good idea. I don't know, do you have specific ones that you like to do, that you use for some of your clients?
Yeah. As you said very well, like it's so important to make sure we're priming all those, detox pathways before phasing in the binders. And yeah, like I've had many, many very sensitive patients as well. So yeah, when it's like, oh yeah, just go on all this stuff right out of the gate, it's like, who are you people? Like, we don't have many
I
patients
haven't
like
had
that.
that luck.
Yeah, I hear you. I hear you. So I dream about those patients. But once we have all that in place, like I kind of frame it to my patients like, okay, now we're going to start very gently poking the hornet's nest, because because if we start killing off mold that's colonized the sinuses, especially if there are biofilms afoot and they're just really entrenched, then they're going to start fighting back the only way they know how, which is to release even more mycotoxins. So if the liver and the bowels, the other emunctories aren't ready for it, then it's not going to go well. But yeah, my go-to nasal sprays, like I really like a diluted frankincense essential oil nasal
Oh
spray.
yeah,
It's
that
one of
makes
my
sense. Okay.
go-tos. I also will use silver hydrosol spray if we want to start going after biofilms a bit too.
Hmm.
Also, it's just not caustic the way that essential oils can be.
Hmm.
There's this combination that one of my colleagues came up with, and it's a combination of like xylitol, iodine, grapefruit seed extract, and something else that I'm forgetting. Oh, and EDTA actually. So there's a few different combos, and if you'd like, I can email you
Oh
my.
yeah, I definitely want to know that one because we definitely do the xylitol and the grapefruit seed extract, which are great because I use grapefruit seed extract a lot for in terms of if patient for gut health issues, if they have overgrowth of staph or strep and things like that. So I can imagine that that would be super beneficial as well. So
Yeah, it can
and
be. I find.
biofilm, you reminded me, that's
Mhm.
another thing is we look at things like biofilm also for Lyme disease, like nattokinase, lumbrokinase, things like that. And so what biofilm is that for people listening in, like that mucosal layer covers, it basically allows these viruses or any kind of toxins to hide from the host. And so you want something that helps to get rid of this biofilm. And so things like lumbrokinase, nattokinase, there's many different binders, even stevia is not binder, I'm sorry, biofilm are helpful to rid of biofilm itself too. And usually those are the things I have people on longer because of the fact that people are having these persistent chronic infections. I find they need to be on things for biofilm longer. Like even if I took them off of the other herbal protocols, they might need to be on something for biofilm longer so I can prevent kind of like it coming back because of the fact that, especially for somebody that's had Lyme disease or a chronic infection for like 10 or 20 years, I want to make sure that kind of stays away. And so typically I want people to be stable for a certain amount of months before I start pulling those things out.
Mhm. Yeah, couldn't agree more. And I think one thing that we can, I'm sure, both agree on is like, say what you will about Borrelia, can say lots of bad things about it, but it is mighty good at hunkering down. It goes into those round body forms and it's like, I'll just hang out until the moment is right. And if you leave a little bit of biofilm behind, like it's just, happy as to curl up in there and just
Exactly.
hang
It's a
out until.
party.
Yeah, exactly. Yeah, exactly. One other question that just springs to mind. Actually, I was consulting on a certain case today, and just one thing a patient mentioned to me, it was kind of like, oh, this is just timely that I'm interviewing someone like yourself today. We were talking about her daughter, and her daughter's been struggling for years with her health, and she's making headway, but it's been a slow, like arduous process, but making headway. Seeing lots of doctors, like the same old story.
Mhm.
Anyways, she kind of made this offhanded comment about like, oh, like, just, my daughter, paraphrasing here, but kind of like, my daughter's going to have, like, I know she's going to have Lyme in her body for the rest of her life.
Mm.
And again, this might be something that, folks might kind of hear through the grapevine, maybe hear like in different, patient groups or whatnot. But if somebody said to you like, oh, I've been sick for years, like, sure, maybe you can help to manage my symptoms, maybe I can feel a lot better, but like, I'm always going to have this Lyme in my body, like these Borrelia spirochetes in my body, like, what would you say to that, that like.
And I do get that question a lot. And
Okay.
then my piece is that you could have it, you could still test positive with your antibodies and your body just learned commensal, like it learned to live with it and not have a reaction or response to it. Because I
Mhm.
have had, like I said, patients that have their numbers are higher than their significant other and they have no symptom. They only
Mhm.
tested because of that. So my question then is like, why is it that one person could have, like I've seen the partner have like 12 bands
Mhm.
and that literally 12 bands and then nothing, no symptom. And then the wife has like 5 and is completely not well. And so what I think is like, what is going on constitutionally in their system, that because we get exposed to things every day, right? So we constantly are getting bombarded with bacteria, viruses, our microbiome is billions, in our stomach, more than digestion, in our gut microbiome than any other piece in terms of our cells and stuff in the body. And so why is it that one person will be so reactive and then another person has no symptom? And so what I say is, it's like, what is that person's constitution? But there could be a lot of reasons that can weaken that. So stress is one, as we know. especially for women, I say hormones is a huge one. If they're like how their gut microbiome is, food sensitivities, food allergies, if that's strong, to be able to help with the immune response and just like general overall immune function. And so I will often say, like, once I get a person better, and I've seen it. And the one thing is, I hear when people say, oh, it's been 10 or 20 years I've had it, so I'm never going to get better. But I don't think that's true, because I've seen people that have gotten treated for 10 or 20 years and they've become asymptomatic for a long time. And I've also seen people the other way, that it was recent and they've struggled with illness. So again, why is that versus the other? And so what I'll say is, oftentimes when I get people stable and well, I kind of warn them of these things, like, what are going to be your triggers? Extreme stressful event. I've had that, or patient didn't see them, didn't have, or have patients haven't seen them for 2 years. And then all of a sudden they're like, everything started all over again. And I'm like, what happened? And they're like, oh, my father died. And I'm like, okay. And some of the patients, I'm like, okay, so I'm not going to even really get, what have you done for it? Have you went for therapy? I've had actually one really great case that went to go get there, things like that. And immediately, like within that week, back to the way she was before. So I didn't need to, as a doctor, prescribe anything. I didn't give her anything. She just really needed support through that process. And so that just is a great example of how like stress can really downregulate your immune system. So what I say is, like, these things are kind of lingering around, like you have these antibodies, but what can actually activate it? And everybody's different. I've seen that happen when people got COVID, like that piece get reactivated where they had Lyme disease from before, hadn't seen them for a year and a half, got COVID, and it was like they got Lyme disease all over again. And I was like, I don't think you got Lyme disease over again. I think it was there, and the inflammation was what kind of stirred up the pot, and we just need to treat you the same way, and it'd be over and done with in like 1 or 2 months. So also for women, since I did write a book called Women in Lyme, and the reason I did that was hormones plays a huge factor for women on chronic disease conditions like autoimmune conditions in particular, and things like Lyme disease. And so especially if a woman is perimenopausal or menopausal, where I'll see, we look at testosterone. Testosterone is an anti-inflammatory. That's not that goes down as you get older. Progesterone, when women get older in that age, it drops, and progesterone helps to balance out TH1 and TH2 in the immune response. So all of those things that are like protective for us will actually go down as we age, and it's going to make us more susceptible from being more influenced by having this tick-borne infection, or be more influenced with having an autoimmune condition. So then what I say is, like, how do we work to make sure your hormones are balanced? How do we work to make sure your stress stays stable? How do we work so that your immune system is stuck? Like, what is that trigger for you? Because that typically will keep you in a state of homeostasis, of being well. But you can definitely have the antibodies forever, but it doesn't necessarily mean, I still sometimes have antibodies when I check, and I'm not symptomatic. But it's really like how your body is actually responding to that. That's usually my answer. I gave a long-winded answer, but it's always a hard answer, because people really fear that, of like, am I going to struggle with this forever? No, you don't have to struggle with it forever, even if you've had it since you maybe thought you were a kid. But we need to figure out, what are those like mitigating, what are those factors that potentially make it worse, and what do we do to resolve those?
Yeah, absolutely. It's a convoluted topic, and the kind of I gave my answer to the patient's mom earlier today, and she gave me some really nice feedback, saying like, oh, like that makes me feel so much better. Like it was something that was like really eating at her, and it's like, oh, like it kind of helped to set her mind at ease. So I think, yeah, the way we answer that question is really important.
And
Also, just
and also the one, sorry, one of the things is, I'm glad you said that, because that's also one of my personal challenges, is I have a lot of people, and I love what you said, is that they left feeling positive, but I have a lot of docs that do focus in the same areas that we focus on, Lyme disease, tick-borne infections, MCAS, autoimmune conditions. And somehow, sometimes the wording of how providers say it's really, to me, feels very hopeless, of like, you're going to struggle with this forever. You're going to be on these things for the rest of your life. It's never going to go away. And I just never, we just have to be careful of that, because your mind can, your body can, your mind can say messages to your body that are negative, that can also cause not good health. So I just am mindful of that, in terms of that folks are working with people too, where they actually leave hopeful. And that's one of the biggest things I say culturally when they come to our office. They always say, they're like, oh, I feel like there's hope, or I feel like something could happen. Like that's part of wellness too. That's part of healing, is actually feeling hopeful. So you never want to, I think, continue working where you feel kind of you feel discouraged every time you leave an office visit with whatever doctor you're seeing.
Yeah, 100%. And I get similar feedback from my patients, and it feels good. It's like, okay,
Mhm.
inspiring hope. And I mean, I'm just saying from my own experience, but just for folks listening, it's like, oh, if you're like, oh yeah, when I talk to my healthcare provider, like there seems to be this, like, it's a bit of a doom and gloom thing. It's just like, I'm just trying to
Mhm.
level with you, patient, but like it's not going to be an easy road, and you might only get so much better. But when I've heard that feedback from other patients saying like, oh, I was talking to Dr. So and so and heard this, like when I've had some insight into what that other clinician's practice is like, it's kind of like stereotypically it's usually with docs where they're a bit more I don't mean this in a condescending way, but a little bit more myopic, where it's like, yeah, like all I treat
Mhm.
is like Lyme
Mhm.
and co-infections. It's like, well, if you don't treat mold, and if you don't know about MCAS, and you don't know about mitochondrial
Mhm.
dysfunction, et cetera, like, yeah, a lot of your patients are not going to get all the way better. So I
Exactly.
think it might have to do with like just practitioner limitations of their knowledge. Not that, we certainly don't know everything. I always think like, oh, 50 years ago, like state of the art medicine compared to now, it's like, oh my gosh, like the Stone Age 50 years ago, 50 years from now, we're going
Completely.
to be so much further ahead. But, we do the
Yeah.
best we can. But I think
And
that's,
keeping open and keeping your mind open, because I think as a doctor you can also become like myopic, like you said, of like,
yeah.
this is Lyme disease and co-infections, and I've had it where patients, like, no one ever tested them for, like, checked their thyroid or checked, like, I've had patients, many that I've gotten diagnosed with autoimmune conditions, and I'm like, oh my gosh, you were getting treated for Lyme, which was important, like for 20 years, and your ANA is like 1/1200 something, or and your rheumatoid factors through the roof. Like, how did this happen? And it's because people become so specialized. They're not looking at, like, what are all the as someone, my thing is, I always tell patients, if they're not feeling better with treatment after 3 to 6 months, that there's no movement at all, then that means it's probably something else that's not being addressed. That it shouldn't be 2 years before you actually feel an improvement. That doesn't make sense.
Yeah.
So
Yeah. I couldn't agree more. Um, I'm just noticing that our time's starting to wind down, and I would really kick myself if I didn't pick your brain about low dose immunotherapy, Dr. Patterson, because as we touched on before we started recording, you're one of the rare docs out there, myself
Mhm.
included, that actually use low dose immunotherapy. There should be more because it's
I
such an
agree.
awesome therapy. You mentioned you've been using it for several years now, so would you mind? And maybe just in the interest of time, we'll just, if folks aren't familiar with the low dose immunotherapy, maybe,
Mhm.
check out our social media posts or whatever it is about that. We don't need to get into a background on it per se, but would you mind just speaking to your clinical experience with it? What
Sure.
are some things you like about it? What have you seen? And maybe just share some pearls around it if you don't mind, please.
Yes, it's been really a game changer for a lot of my patients, especially the ones that I see, and it'd be interesting to know for you, but the ones that I've seen that have been to more than the 7 to 9 doctors, or have done everything.
Mm,
Those are the ones that I've seen it honestly push the most. And I think the reason is LDI really helps to balance out what they call the Th1 and Th2 response. But the people I find it works the best are the people that have the most immune dysregulation, where they're just like, their immune system is not good. And so that's why they're not responding to those other treatments. So what I love about it is that really what you're getting to, it's a deteriorated virus. It's specific. You can have like EBV, which is mono. You can have mycoplasma. You can have Lyme, Bartonella, and sometimes you can do one or two. But the interesting thing is, for me, if you look at autoimmune conditions, most people with autoimmune conditions, in terms of the studies, have shown they have at least 1 to 2 chronic and persistent viral infections. So I especially love it for Lyme disease, but I also love it for autoimmune conditions, because sometimes it's like, well, was this virus the precipitating factor for this autoimmune conditions? There's tons of studies on like Lyme disease and MS, or I've seen that with rheumatoid arthritis and Lyme disease as well. And so, and EBV and Hashimoto's. And so if I have someone, for example, with Hashimoto's, and they tell me, oh yeah, I got, mono when I was 18, and then I got diagnosed with Hashimoto's like 2 years later, EBV may have been the precipitating factor. And so it's awesome to be able to have the LDI and to do EBV and see those improvement in symptoms. And then sometimes I've had people with Lyme disease that I've been treating, and they said, oh yeah, my history, I've had EBV. And we do LDI with Lyme disease, they make a little progress, but then I'm like, I have a feeling we need to do EBV, and I do EBV, and it's like everything's better. They're like, my sleep is better, even for pain. I've even had it improve pain, which obviously EBV and mono isn't known to do. However, again, it's because that was like the precipitating factor. We also at our office see a lot of kids with PANS and PANDAS. And so LDI also has it for strep. And so we all often use it for that, or mycoplasma, which is another common infection, or Lyme disease related with PANS and PANDAS. So it's been a great one. And for all of you to consider, there's only like a couple hundred practitioners still in the country that are trained in it. There's definitely an art in knowing what number to do it, because, you know, there's a variety of numbers you can pick from. I think I also had experience in homeopathy, so I feel like for some reason I know what number to begin, but honestly, it's literally an art, and there's a skill to just knowing what that is. It's to be honest, an intuitive thing from just experience. But it's definitely something that should be considered if you feel like, especially if you feel like you haven't made any progress with other approaches that you've done, integrative or just through conventional medicine.
Yeah, it can, as you said, it can be such a game changer. And yeah, I'm glad you mentioned about PANS and PANDAS, because it's been one of the most powerful therapies. Like, you know, I feel like there's, you know, in terms of biggest game changers, like, you know, IVIG can be really helpful, but like, man, sometimes that strep LDI is like just as impactful, if not more impactful. And like for a fraction of the price and no intravenous
Exactly.
therapy, it's like, yeah, it can just really be so amazing.
And every 6 to 8 weeks, it's so straightforward and simple. I mean, you can't get a
It's
better
really,
better treatment than that.
that
So
is true. And I'm just wondering, just where you have a focus on women's health in your practice as well.
mhm.
I'm just wondering if, I guess maybe a two-part question. Like one is, what have you found benefit of LDI in that patient population around just, you know, sort of, you know, say dysmenorrhea, menorrhagia, PMS symptoms, things like that. And then the other question would be, I'm sure you've had patients in your practice who are suffering from, you know, chronic infections and things like that, where they're like, oh man, like around this or that time of my cycle, like my symptoms are so much worse, like my pain's so much worse, my fatigue's so much worse, all my inflammation so much worse. In that kind of subset of your practice, have you found LDI to be helpful in any of those cases?
Oh, completely. And I do know, I usually do it mostly for infections, but I do know he has LDI for like parasites and chemicals and other mixes, I think, and hormones. We haven't actually used it that way, but I do
Okay.
often see like once the if let's say I do Lyme disease, once I get those in order, I'll often see like the other things will kind of fall into line.
Hmm.
But in terms of inflammation, I definitely have seen a change. I mean, that's one of the things for, especially for Lyme disease, my patients that might have knee pain, hip pain, they'll come in exactly at that mark, and we might need to do a booster dose, which means like a dose in the middle, because they'll often say, they're like, oh, I'm feeling good, but I know I need my LDI dosage because my knee pain is starting to come back, or my hand pain is starting to go back. So typically the symptoms I see improve are more of the physical, like the physical pain, and also energy, like the fatigue. They'll notice right away of like, oh, wow, I only need, especially my patients with EBV, I have some of them needing, like, my best case, I just saw her today, was sleeping. It was literally 16 hours a day for a year and a half, and actually stopped being in, she was a college student, had to stop being out of college. So we did a few things. After a couple of months, I'm like, these things aren't shifting. Let's go for it. Because at first I was worried, sometimes with LD, I can get a shakeup. So I was like, oh, I don't want her to be sleeping 18 hours if there's like a Herxheimer reaction. But at that point, she's like, I have nothing to lose, just do it, because she basically wasn't in school. She was sleeping most of the day. We did it and it was like immediate. She's like, oh my gosh, I got through a day without needing a nap. And so
Wow.
she went down and improved every month. It was like an hour less, like 15 hours, 14. And so I just saw her today, and she's down to 9 hours of sleep and is working a job. She couldn't work. She's working 25 hours a week. She's back in school full time, plus working 25 hours a week. Whereas this was a kid 2 years ago that had to actually drop out of school because of that. And that was literally only from LDI. So yeah.
Yeah. Yeah. It's amazing how much it can impact some cases. Like, as I think you were
Mm-hmm.
alluding to, it's not a silver bullet for every case,
Mm-hmm.
unfortunately, but the cases that need it, like, by golly, it's the best thing
Exactly.
ever.
It's
So yeah,
amazing.
it's really cool.
Yeah.
I know we just have a couple of minutes left here before we should wind things up because I know
Mhm.
you need to get going and I need to get to bed as well as it's pretty late
Exactly.
here. But I was just wondering, just kind of rapid fire question, like, are there? Would you mind sharing like maybe one or two things that you're just kind of currently excited about, like maybe newer things in your practice, things you've learned about recently, just anything that you're just kind of springs to mind is like, oh, I'm excited about this or that right now, that's kind of newer to your on your radar.
I think some of the new studies on the gut microbiome, like Akkermansia, which you probably have heard of, because been a lot of studies of these different gut microbiomes I've been studying related to, like, for example, with Parkinson's and Alzheimer's, things
Mm,
like Akkermansia showing like 20 years prior to diagnosis. So I've been looking a lot more of being more specific on like those specific microbiome that change relative to specific autoimmune condition. I think there's still not enough out there for Lyme disease yet. I think
mm,
we're going to know more. So that has been more intriguing to me because it's like, hey, is this information just like infections? I always tell people like me who have a predisposition potentially to have an autoimmune condition, are these viruses like me getting, or infections like Lyme disease or EBV, is this what happened to my mom, 20 years, am I getting these things? And then me being able to regulate and manage that, preventing the onset of that. So I think that's part of where I'm doing more looking into, of like, what are the things that we could pick up now that may be preventing the onset of disease in the future, 10 or 20 years from now.
yeah, yeah, it's exciting stuff. Absolutely.
For sure.
Well, just before we wrap things up here, Dr. Patterson, would you mind just sharing with folks if they're interested in working with you? Or I know you mentioned you've written 3 books. You mentioned one of them. Maybe you could mention the others, where they can find you on social media, any online offerings you have. Anything you mentioned, I'll post in the show notes for the show. So I'll put links for folks who are listening. But would you be able to just share some of
Sure.
those resources?
Sure. And then on my books, you can go into Amazon. You could just type in Dr. Jaquel Patterson. I actually have an Amazon book account. So you'd be able to see the list of books. And then in terms of my practice, it's fairfieldfamilyhealth.com, which is Fairfield, FAIR, field, familyhealth.com. And then on Instagram, I'm pretty active, my Instagram account, at naturopathic.physician. So that's probably the account I'm most active on. I have a couple other accounts, but that's the one that I post the most. So that's a great way to connect in, see just general health information, reels, if I can remember to do them consistently. It's always the challenge, but
Mhm.
it's a great way to connect and get information. And then obviously through that website too, as well.
Awesome. Great. Well, thank you so much. And thanks so much for the chat today. I really appreciate you being such a thorough, versatile clinician. It's always a pleasure to talk with someone who's, yeah, just obviously really care about getting people well, and your, yeah, vast knowledge really speaks to that. So thanks so much for your time today, and I really appreciate it.
You as well. Thank you so much for having me.
My pleasure. And thanks to our listeners. This concludes another episode of the Overcoming Chronic Illness podcast. Please stay tuned for the next one.